welcome to today's webinar in the series Challenges in Pediatric Neuroscience Research. My name is Adam Hartman, and I'm one of the program directors in the Division of Clinical Research at the National Institute of Neurological Disorders and Stroke, which is one of the institutes at the U.S. National Institutes of Health. I have a number of pediatric clinical trials and other human subject studies in my portfolio, and I'm also a practicing child neurologist and epileptologist. We created the series to help investigators overcome some of the challenges that they might face in pediatric neuroscience, including neurology, neurosurgery, psychiatry, psychology, neurodevelopmental disabilities, physiatry, critical care, emergency medicine, pathology, radiology, and pharmacology, just to name a few, and there are many others. The ultimate goal is to improve the quality of care for our patients, but the more proximal goal is to enhance research that will facilitate improvements in practice. Our webinars are targeted to trainees, senior investigators, and even to those who are not currently involved in research, making the pie larger, so to speak. Today, we're hosting one of our own colleagues from the Division of Clinical Research at NINDS, who will be discussing and describing some of the NINDS Common Data Elements, or CDEs. As you will see, the discussion will address the topic at many different levels in a very thoughtful way. First, a few technical notes about the webinar. The session is being recorded and will be transcribed and archived on the NINDS website. Details about where to find the archived version will be posted on social media and professional society listservs and newsletters. There will be a question and answer segment at the end. To ask a question of our presenter, you can either click on the ellipsis near the bottom of your screen and click on Q&A, or open the participant window and on the bottom right, find the bottom of your screen and click on the Q&A area. I will moderate the question period. Special thanks to NINDS staff for the technical support and coordination of the webinar, and the NINDS Office of the Scientific Liaison for all of its support and the publicity. I also wanted to introduce a new co-host of the series, Dr. Christy Hardy. Dr. Hardy is a pediatric neuropsychologist who's joined us also to oversee the growing pediatric neuroscience portfolio. She was previously a clinical pediatric neuropsychologist at Children's National Hospital and held a number of R01 grants for her research in the neuropsychological aspects of brain cancer and its treatments. Many of you who attended the recent Child Neurology Society annual meeting had the opportunity to meet her, and we're really thrilled that she's now at NINDS. Welcome, Christy.
Thanks, Adam, and hello to everyone.
Okay, so let's get started. Our guest today is Dr. Carolina Mendoza-Puccini, who is a program director in the NINDS Division of Clinical Research. She obtained her medical degree in Columbia at, sorry, Carolina. At the Universidad del Norte Medical School, Carolina is the program officer for the Strategies to Innovate Emergency Care Clinical Trials Network, or SIREN, and the Clinical Trials Readiness Project. In addition, she manages the NINDS Common Data Elements project, which is why she's here today, and participates in various trans-NIH data harmonization working groups. Her main interests are data standards, common data elements, and data sharing. Before joining NINDS, she was a research fellow at the University of Miami Miller School of Medicine, Department of Neurology, Division of Cognitive Disorders. Welcome, Carolina.
Okay, thank you, Adam, for the intro. So I'm Carolina Mendoza-Puccini. My pronouns are she, her, and I oversee, as Adam said, the NINDS Common Data Elements project. So Adam mentioned that we're sharing the slides, so don't worry about making notes or checking the links, but everything's going to be in the slides. Before I start, I wanted to acknowledge all the people, because I'm not the only one working on this project. This is group effort. So first, I wanted to thank all our working group members, our collaborators across NIH, other federal agencies, patient advocacy group, academic institutions, etc. Our own NINDS program staff, especially Alba Recinos, that is my analyst that works with me directly in this project, the contractor that works with this CD project, and also our users. So I'm going to start giving you an overview. Just to, this, in the interest of time, I'm going to do a very brief summary of everything that I think are the most important things about CDEs, or data standards. I'm going to talk to you about NINDS specific ways of doing CDEs, NIH-wide, and overall CDEs. So let's start with how we were created, the NINDS CD Projects. So we were born around 2009 and we started with 8 disease areas. Right now we have 25. We were the first NIH institute developing CDEs. And as I mentioned before, this is group effort. We work with other NIH institutes and centers, other federal agencies, nonprofits, academic institutions, and also national organizations. So let me start with why are the CDEs important? And I'm going to repeat this a few times because I think that, this is not only because I'm passionate about this topic, is because I truly believe, and NIH believes, that this is important. So in terms of NINDS and NIH CD funded projects are open access. So one common misconception is that since it's an NIH funded project, it's only for NIH researchers. So this is not. This is an open access. It's free to use for everyone. So it doesn't matter that you're going to use these CDs in a project that is not funded by NIH. You can access it, you can download everything, and use it in your projects. So some instruments or some things that you're going to download may not be available, and those are the copyrighted ones. So that's the only caveat or thing that you have to take in account. However, you find information about these instruments. Another benefit of using CDEs is that it's going to increase your precision in how you collect your data, because you're going to do it in a standardized way. So it's going to minimize the variability. It's going to improve efficiency because you're going to have case report forms, code books, or data dictionaries that are ready to be downloaded. You don't have to reinvent the wheel. And also the work was already done by a group of subject matter experts. You don't have to determine or start from zero in thinking, okay, what will be the best way to collect cognition in a stroke study? No, that's already in a list. The experts did that work for you already. The CDs can also be a tool to link data sets and examine relationships, even if there's not a one-to-one mapping across all data elements in multiple data sets. So that's something that is more like technical information on how to map, and I'm not going to talk about that today, but that's just to keep in mind. Also, it will give you the opportunity to gather data in a fast way, to accelerate research, to accelerate the way you share your information, you improve discovery, and also to improve with those results public health. So one important thing when we talk about data in general, and this is something that you will always hear, is the FAIR principles. So the use of CDE will lead the breaks through science and data fairness. So that's the FAIR is findable, accessible, interoperable, and reusable. So now let me tell you what is a CDE, and this is very basic definition for people who have never heard about it. Or don't know a lot about it. So a common data elements is a precisely defined question, and that question is going to be paired with a set of structured responses. And why are they common? Because they're going to be used in multiple sites across studies, data sets, research initiatives, projects, etc. So an example here below is race. So this is the short name of our variable that is race in USA. So the definition is the patient's self-declared racial origination, independent of ethnic origination, and we're using the OMB approved category. So this will be more for government funded study, but it's just an example. And the list of the structured responses are here, and they're called permissible values. So this is just to show you that across a study, every single site will collect race in the same way. And the CDE is just a unit of data collection. So if you have an instrument, for example, the Mini-Mental, a CDE will be every question on that Mini-Mental. So other benefits or other things that CDEs do is that they improve interoperability. What I mentioned before, the I in the FAIR principle, it will allow you to do easier, do a reanalysis, meta-analysis. It will foster collaboration. It will also, what is the most important thing or that you want from your research is good data. You know, it will improve your data quality. It will allow data aggregation across projects. It will increase statistical power, and also it will make the data AI ready. So another good thing is that reproducibility. It will enhance the scientific rigor of your research. And as I said before, it will allow comparisons across studies and will reduce inconsistencies because it minimizes all the variability. It will also improve efficiency of collections. So these are like off-the-shelf elements, case report forms, data dictionaries. So as I said before, you don't have to reinvent the wheel. Everything is readily downloadable, either the actual case report forms, data dictionaries, or the information about an instrument that is copyrighted. And then, you know, efficiency of use. It facilitates your data harmonization, and at the end, it will save time. It will save also, you know, funds from your budget. And if you're doing an NIH, or if you're preparing an NIH application, it will also add value to the NIH policy on data management and sharing. So I encourage you, if you're doing that, and I will talk about that a little later, on when to start thinking about the use of CDEs. So now I'm going to switch to how we develop CDEs, and this is at NINDS. So the way different projects select their CDEs may be similar, but it's not the same. So you will find some variations. So this is how we do it at NINDS. So we start identifying the CDEs. So that may come from different ways. We may need to develop CDEs because there's a mission critical gap. For example, when COVID started, that was a need that we had, and we all started working on the CDEs right away. We can be approached by a group of people, by investigators, and we do have a way to receive that nomination. You know, if you're interested in proposing that we develop CDEs. Also, we have, you know, if there's a clinical trial that is coming and we need data standards, that's another reason. And other more, you know, those are not the only ones. As I said before, it's a collaboration. Whenever possible, we try to align with international data standards. So that will be the R in reuse. So instead of reinventing a new way of collecting X or Y data, then we look at what is developed already in the community, and then we will reuse those. And then, you know, we get insights from patient advocacy groups, from industry. We try always to incorporate them in either the development process, to add them or invite them to our committees, or in the public review. And then we, as Institute, the NINDS, will provide a general oversight, but these are groups of external subject matter experts, and they are the ones that make the decisions of what to incorporate or what to add or recommend as CDEs or instruments in the different disease areas. So this is the form. I'm not going to spend too much time on this, but if you're interested in proposing CDEs, either add to existing disease areas or create a brand new project, there's this form that is open to the public. And then we encourage you to work with a program director that has that disease area in its portfolio, or to contact me, and then we can discuss about what are your plans. So this is the timeline on how at NINDS we develop our CDEs. So I'm not going to go to every single step, but I'm just going to give you a summary. So overall, that whole process takes about 18 months. So it's not that we sit down and, you know, talk and develop in a couple of months. It's a comprehensive process. So it starts with inviting all the members. They have their different meetings. They go through an internal review process. Then we go to a public review period. And after that, we post it in our website. So the CDE classification, this is again only for the NINDS project. You're going to see different way of projects defining their CDEs. They may be a lot of similarities. For example, they may have like a small set of CDEs that are required, and they may be called different ways, core or tier 1 or required. So it will depend on the project. So that's why you have to, be cognizant of in what context you're using the CDEs. And I'll talk about that later. So here, don't worry if you don't get all this classification, because it took me a while to understand and like memorize them and know who they are. But overall, we have the core CDEs are CDEs that for NINDS trials are required. So they're usually a very short list of CDEs. They're divided into general core that are disease agnostic, though can be demographic, social determinants of health. And then we have the disease core that are, as the name says, it's applicable to that particular disease area. So why are they so, the list is so short? Because these are CDEs that will be applicable to every single study or trial that is doing research in that area. So if you have a stroke trial, there are not many of the data points that you want to collect in every single stroke trial. So there may be like 3 or 4 CDEs, or maybe only 2 for disease area. We have some rare diseases that don't have any disease core. Then we have the supplemental highly recommended. These are where most of our CDEs are housed. So these are CDEs or instruments that are validated. They're widely used in the scientific community, widely adopted, accepted, and they're going to be specific to whatever you are studying in that. Like if it's stroke, cognition is going to be there, rehab, all those different categories. Then we have the supplemental that are also validated instruments. However, they're not going to be that widely used or accepted. However, there may be some smaller groups that are using these type of instruments. And then the exploratory, they're instruments that are not validated. They can be that they're not validated for that particular disease area or not validated at all. So these are they're not that widely used. However, they're important because they can serve like 2 different objectives. One, there may be some instruments that we know that they may be validated in the next couple of years. So we're keeping an eye on them. Or they're instruments that, there's nothing else available in that particular disease, like a rare disease, and they are used a lot by that, disease area community or scientific community. So this is a list of all the disease areas that we have at NINDS, and I marked with a little red star those that have pediatric CDEs. So there's cerebral palsy, and we do have pain, and I forgot the other one, but we have new CDEs on cerebral palsy that were released a few weeks ago. Epilepsy, mitochondrial disease that is currently being revised, neuromuscular diseases, neuro rehabilitation, spinal cord injury, stroke, and TBI that will be revised in the next couple of months. And our new or most recently released and revised disease is Parkinson's. So I wanted to give you examples of some other CD projects at NIH, and I'm probably missing a few. Sorry if some people here are attending and I missed you. But I want to start with the first one here, the NIH CD repository. So this is the centralized repository for all NIH CDEs, and they're housed at the National Library of Medicine. And I provided all the links at the end, and I also have the links for every single project here. We also have the Phoenix Toolkit that has many pediatric CDEs and a great collection on social determinants of health, COVID-19. We have the National Institute of Mental Health. The other one is the National Cancer Institute that has huge CD repository. Fitbird that also works with NINDS, and they actually use the NINDS CDEs, at least the core elements. And this is a project where it's a repository for all TBI studies at NIH. Then we have the National Institute of Child Health and Human Development that has recently released a collection of maternal health and pediatric CDs in COVID-19. And they're posted actually at here, the next one, the National Institute of Environmental Health Sciences website, The link is there. And the last one is the health measures that we have, PROMIS, NeuroQol, and other measures that also have pediatric instruments. So this is our NINDS Common Data Elements website. QR code and links are there, and I'm not going to go into details on how to use it, but there's a contact form there, and I'm providing my email in case you have questions or difficulties finding things. So now I'm going to tell you all the things that you should think about when you're putting together an application for anything. It doesn't have to be for NIH, but in terms of data standards. So I'm not going to lie to you, if you've never worked with CDEs, there's going to be a learning curve. However, there are many benefits in addition of the ones that I already mentioned. So the learning curve will be for both investigators and also your program staff. So hopefully you have a data center or data coordinating center or data team that can support you in devising a plan, if it's an NIH application, like the data management and sharing plan, or overall, it doesn't matter of who is your funding agency, of making sure that you have a good plan on how to collect your data. So coordination is important, obviously, to duplicate efforts. As I mentioned before, there's different groups developing CDEs, so you will have to identify what is the best CD project or CD collection that you are going to use for your grant or project. So I was talking about in the first items that I mentioned about brand new projects, but sometimes we may have projects that have been collecting data for the last 15 years, and then you want to merge two data sets, and I think that's going to take a lot of work and effort. That's not my area of expertise. I only know that this is not easy. However, it depending on what your goal, you will have to map that existing data into new CDEs, or map the existing CDEs, etc. But it is possible to do. So bottom line is identify the use of CDEs from the get-go of your research initiative. And I'll tell you more here in the next one. So I'm repeating a little bit what I said before, but I think it's important again to think, okay, the first thing is, who's going to be my research funding agency? So is it going to be research like NIH or a regulatory agency, FDA? What type of study is the one that I have? Is it a professional society or any other nonprofit that you're applying to? So make sure that you read the funding announcement thoroughly, that you ask all the questions, you meet with your program officer, your contact person, and decide what are the requirements, and then what are the CDs that you have to use. And also choosing the CDs, taking account that is group of CDs that have been used in large projects, in known projects that that they have a good quality, and that may be a little tricky, but if it's a known group or known organization that are developing or providing these resources for the public. Also that they have a good acceptance and adoption by the community. And then that's the way you finalize how you're going to use or what CDs you're going to use. Then the last thing to take into account is that endorse or require CD use. Chosen CDs are endorsed by the convening organization. So if you're going to use, we currently don't have a lot of NIH endorsed CDs, but we have some, and we're working on endorsing more. As I mentioned before, is it mandatory to use the CDs? Is it only a recommendation or not? So that's why it's important that you talk to your contact person of that funding announcement. And also, how's the compliance and how it's monitored and enforced. Sorry. So one of the situations that accelerated the use of CDs was the pandemic. So we needed urgently a way to collect data efficiently, to collect good quality data that was interoperable, So NINDH put together many groups across institutes and centers. And this is just a list. I know there are more projects, but maybe you're familiar with the Phoenix COVID Collection, Recover, RADx. And at NINDS, we have the COVID-19 Neurobiobank and Data Bank that is collecting data on patients that had COVID-19 with neurological manifestations. Here, this is just an example of how NINDS, and this is just our institute, we have language on CDEs on our funding announcements. So we currently have 2 funding announcements with CDE Language. And here you have, this is for UG3 stage, and there's a list, you know, we encourage the use of the following resources. So we have PROMISE, the NINDS Common Data Elements, NeuroQual, NIH Toolbox, etc. And then in the review questions we have, is there appropriate consideration given to utilizing the NINDS Common Data Elements? You're going to find that the language will change from institute to institute. So that's why I emphasize that this is just for NINDS. There are different requirements by different institutes. So this is a busy slide, but just to show you that these are our extramural networks, StrokeNet, NeuroNext, and NET and Siren. And from these networks, I just highlighted here in red, those that are pediatric trials or studies that are enrolling pediatric participants. So in StrokeNet, we have iAcquire, and these are all using common data elements. NeuroNext is FXLearn, NET has ESET and Rampart that are enrolling both pediatric and adults. In Siren, we have Boost 3 that is enrolling 14-year-old participants and older, and a pediatric trial that is pediatric ISCAP. And we also have use of CDEs in the intramural of NINDS. So I told you about all the great things about CDEs, all the benefits and everything, but I understand, and we all know, that the use of CDEs has its challenges. So one of and this is just a brief list of some of the challenges. So first one, something that I mentioned before, many groups developing CDEs. So sometimes there's lack of consensus, and it may be a little challenging for the investigators to decide, okay, what will be the best collection to use, this group or this group. So that may be, you know, a little difficult. Then this is more for instruments and has nothing to do with CDEs, but is related. The instruments, many instruments are copyrighted, and you know, the copyrighted instruments are expensive. So that's something that may be a limitation. Then you can also find, and this is also related to instruments, that there's a variable validity in different populations. For CDs, sometimes you may find that they're not appropriate for epidemiological studies, observational studies. They're more be towards the use in clinical trials or clinical settings. You will also find, if you're doing preclinical work, that there are close to none, I would say, very little groups developing CDEs. So I think Fitbit has some preclinical CDEs on TBI, and they're working on developing more. And we also have some things in the works at NINDS. I'm not sure about NIH. And then variability in interpretation and implementation. And this is also more for the instruments. And another of the limitations may be if you have foreign sites or if you have international studies, some CDs may not be appropriate for international use, like race, ethnicity, education, and others. And that's it. So let me see if we have questions.
We do. So thank you very much, Helena. That was wonderful. So we'll start the Q&A period now. If as a reminder, please click on the Q&A section on the lower portion of your screen, and you can put a question into the box. So the first question is, this is one that was sent in, what are the criteria used for validation To use a previous published study in the CDs for stroke, it looks like there might be some contradictory ones. Criteria seem to be just published at some point. What is the process for determining the validation?
That is a great question, and I don't really have a great answer. However, we try to do our due diligence in terms of reviewing the instruments depending on the population, the number of participants used, the languages, and we don't have a set criteria for saying this is exactly what we mean for validation across all the CDE projects. So it may vary from one project to the other. So that's a very difficult question. It's something that we come across a lot. And we just try to do and use the experts in determining, and that's something that, I don't really have an exact answer other than we do have certain criteria for each group, and we document that in all our summaries of each study to show people, okay, how we selected that instrument.
So let me just elaborate on that question a little bit further for clarification. It seems like for the general core ones, it's going to be pretty straightforward. It seems like where there might be some variability between diseases is when you have the more either disease specific or supplemental or exploratory. Am I right about that or no?
Yeah, well, for the classification, yes, to be core or highly supplemental, highly recommended, they have to be validated, meaning that, we have normatives, we have things that are published, and that instrument is validated. The problem is that when you have, how do you determine, is this a good validation or not? Or why did we choose this instrument based on the other? And there are a list of things that we have to take in account. Other than you do have the documentation of validation, we also look at, is this like an overburden for the participant, for the investigator? Is this widely accepted and adopted in the scientific community? And we do follow the criteria. Actually, we follow the Phoenix criteria to select these instruments. So it's a set of, I think there's 7 items in addition to validation.
And just to follow up on that, the validation, how does that work by age? So is it, if it's validated for one age group, is it then just used in that age group? And if it's going to be pediatric specific, then there also has to be some form of validation also in the pediatric age group?
Yeah, absolutely. So it will depend on how you're using, and the same with the language. And you will find that information in our documents, and they will tell you, this instrument we recommend it for ages 1 to 12, 12 to whatever, and then to 90. And then the same for the different languages.
So for language, you'd mean, for example, Spanish versus English?
Yes.
Clarify that.
Yeah.
Wonderful. So the next question, thank you, Carolina. Can you please clarify who is eligible to access the CDEs? Are there minimum requirements for individuals or organizations?
So the great news is that this is an open access project, so it's open to everyone. It doesn't matter where you are located, who is your funding agency. The only thing, as I mentioned earlier, is that if we have a copyrighted instrument, by law, we cannot publish that. However, you will find an informational document that is called right now Notice of Copyright. And it has, if the instrument is copyrighted, it will tell you where to find it. And some general information, for example, the population, if it's available in different languages, what is the scoring if it has one, the references. So it's a very comprehensive document.
And where can that be found?
That is found in our website. In each, you will have to go to each disease area page and find it in there. And if you're sure where to find it or what it is, just let me know. And all the links are in the presentation.
Great. Christy, did you want to, I'm sorry, we got another one. Are there CDEs available or in development for autosomal dominant spinocerebellar ataxia types?
Not right now.
Great. Christy, did you want to ask a question?
However, if you're doing an SCA study, we have many of the instruments that are used, and you can find it here. Like, I don't remember exactly off the top of my head, but you go there and you can do a search. Okay, if I'm interested in X or Y instrument, it may be already there. It doesn't necessarily have to be in that particular disease area, but PROMIS, for example, that is used across many different disorders. Most of them are there.
Great, thank you. Christy, did you want to ask a question? So I'll go ahead and ask another one. So what if a group that doesn't have, it sort of relates to the last question about spinocerebellar ataxia. So what if a group that doesn't have a set of CDEs wants to get a set, so to speak, a validated set? How would they go about doing that? Who would they talk to? What sort of material do they need? How far advanced in the thought process do they need to be? How does that look?
Okay, so we do have a form that is online and it's in one of my slides. And if you go there, it gives you have to complete and tell us or tell NINDS, why do you think that we should develop CDEs? If you are interested in proposing or nominating that new disease area. We have, unfortunately, limited funds. So I wish I could say I want to do everything that we haven't done, just complete all the disorders. We do have an internal process, so we have to take in account, how many diseases do we have in queue? How many disorders that we already developed need revisions because they're old? Or if there's a mission critical gap, something that comes either from Congress or like an immediate need that we have to fill, at that gap that we can't wait and we have to prioritize that project.
And so thank you. So what sort of supporting material would be needed? Just the form or letters of support from other members of the professional community? Or how does that, what would help make something sort of, enhance its chances, I guess?
So in addition of the justification of why you think, the other question that we have, I think, is why do you think that the scientific community is ready to adopt these CDs? Because that's another challenge that we have. Even though right now, lately, CDs are like a hot topic in every single meeting that you attend, but even 2 or 3 years ago, it was a little hard to tell people, listen, try to use these CDs, and maybe no, because I've been using the same thing for years. I don't want to change it. Why doing this? What's in it for me? But now people are more aware because of all the new publications, and even COVID, that really accelerated and showed people that we need a standardized way to collect data, because it doesn't make sense to do it, like everyone doing a different thing. So
that's fantastic. So when you talk about using the CDEs, is that something that how would you show that? How would you prove that? I mean, just because I say they're going to be used doesn't necessarily mean they're going to be used. Would something from a professional society help, or a research consortium, or how does that come together?
We do have collaborations with professional associations like the American Association of Rehab, of Cerebral Palsy. We have the DOD. Who else? I think, and other professional organizations that are using our CDs. And how do I tell you this works? We do have a long list of trials that have been used CDs. We have also other use cases from other institutes like NCI. That's the one that comes to mind, but I'm pretty sure that we have more from FITBER, from NIMH. And also anecdotally, I use them when I worked in cognition in Miami with my PI in one of the studies, and I comparing doing things and collecting data without CDs and with CDs, there's a huge difference in terms of time. All the time that you spend first trying to select or come up with why are we selecting or collecting this data in this way, instead of, okay, NINDS experts are recommending this list, let's just go by this. Of also having the data dictionaries ready. I had to do some minor tweaks to upload it into REDCap, but that's another good thing. You know, with some minor tweaks, you have your code book. You don't have to create it, which takes a lot of time.
Great. So the next question, can you go back to slide 12, your slide 12, because it relates to this next question.
And that is.
Nope, next. Yep, perfect, right there. So the question is, are there any CDEs of interest in for rare genetic diseases or autism or intellectual disability?
Yes, so we have many spread across the different disorders. I don't know off the top of my head. If you have an instrument in mind, we have a CDE search page that you can use. If you're, for some reason, you can't find what you're looking for, just reach out to me. You know, we get these questions all the time. You can either email me or go to the contact us page in the website.
So I guess let me reframe something that you just said. Even though there might not be CDEs explicitly for a specific disease state, there might be specific CDEs within that category that might be applicable and may have already been validated for other areas. And so you could sort of, in a sense, I mean, it's a little more legwork, but you could, in a sense, to a certain degree, sort of put your own together. Is that fair to say? I mean, there'd be limitations, obviously, but is that?
Yeah, that is correct. So you may not find like specific guidance for the use in your disease area, but if you already know that that's a widely accepted, validated, etc., for what you're looking for, and you're looking for a data dictionary, case report form, yes. If it's not copyrighted, you may find it in one of these areas, or you know.
And what if it is copyrighted?
If it's copyrighted, you're going to find that document that is called Notice of Copyright. So it will tell you. That helped me a lot when I did research in academia, because yes, it didn't have all the permissible values or all the questions, answers, but it will tell me where to find it, because there's a link to the external site. It will tell me, is it for adults, pediatric, you know, what population? Is it translated or not into different languages? Because I was interested in Spanish. What is the scoring system? It gives you a summary of, okay, you know, if this is the score from this to this, and it will give you a brief summary of what is the instrument about. What is it? What is the objective of the instrument, and how is it administered?
Mm-hmm. Thank you. So another question is, are there data sets available in audiovisual formats like speech patterns or gait or other formats?
No, I don't have. Actually, the first group that developed some like digital technology was the Parkinsons Group that was recently released. So that's something that we're a little behind on exploring and in the CD project. However, we've been incorporating that more and more. You know, we started with Parkinson's, and then you're not going to find a lot of information on our CD project. But probably, I hope that Neuro Rehab is an area where we may find, when we go to the version 2, that we may explore that digital technology.
Fantastic. So another question is, I know that I've seen this up close, but it might help our guests get a little bit of an idea. Can you talk a little bit about the process of determining how something is a core versus supplemental, highly recommended versus supplemental versus exploratory? I mean, there's a little bit of a sausage making process here. Could you give our listeners or attendees a little bit through that?
So this is
just a little bit.
Yeah, the most like complicated part that will be based on it's like a consensus process, but it has different steps and different reasoning on why we do this. So core means that you have to keep in mind, okay, these elements are going to be collected in every single study in this disease area. For mitochondrial disorders, which is one of the most difficult ones, is what are the general core that we think that are going to be collected in every Mito study? So maybe general core will be demographics that you always collect, race, ethnicity, then maybe you want education in there. You may want to add some social determinants of health, but they may be one or two, they cannot be a lot because remember, it has to be in every single study in that disease area. Then the disease core are also the same thing. Keeping in mind, okay, if I'm doing a stroke trial, this is for all stroke trials. So what is something that you will always collect in a stroke trial? Maybe the date and time of the symptoms, the first symptoms. And maybe that's it. I don't remember off the top of my head if they have something else. I think they have one or two things more, but they're not going to be like more than 3. And that's because it's for every single study. So that's how we determine the core part. Then the supplemental highly recommended, it will be depending on disease area of the subgroup that you're using or the subdomain that you're studying. So in here, you will take into account also, is this a validated instrument? So this is something that we need to have in the supplemental highly recommended. And that's like most of the times. Is it validated? Is it validated for different populations and populations like adult, pediatric, etc.? Is it validated for in different languages? Is it accepted and used widely by that scientific community? So for stroke, for example, the MRS, or the NIH stroke scale. This is something that is used widely accepted by the scientific community. So it's going to be that in that supplemental highly recommended. Then the supplemental will be, they're also validated, but these may be instruments that may not be the first option or the first choice when you're assessing something. So if it may not be an NIH stroke scale, but maybe a less known scale, but it's still validated. However, it may be of interest for some groups, not all. So we don't have a lot of supplemental instruments, and it will vary from disease to disease. Most of them will be in the supplemental highly recommended because that's like the biggest pool where people get all their elements. And then exploratory will be things that are not validated. So for mitochondria is a very special case because there aren't many instruments validated for mito disorders. So even though they may be widely used and accepted, they may be in the exploratory classification because they haven't been validated, but there's nothing else. So you have to use something to do your assessments.
Great. Christy, did you want to ask any questions? See if Christy's back.
I want to make sure my microphone is working. Great. Okay. So I don't know if this question was asked while I was trying to get my tech working, but I was thinking about whether it's possible or advisable to use different CDEs within the same study that may be where you're using some CDEs for all of your population or all of the sites that are participating and others that are maybe more intensive to collect for sites or participants where that more intensive or maybe more personnel intensive or time intensive need to collect that data is possible. In other words, when I think about developing or implementing these CDEs in a really complicated, large multi-site clinical trial, recognizing in my specialty psychology that not all sites have access to personnel who might be able to capture these common data elements. If it's possible to say, I want to use the core elements in everybody, and I only want to collect these supplemental things in part of my population within the same study.
It depends on what are your specific aims. So my answer can be yes. If you're using a core across everyone, so at least you get a standardized data, and then you have a subset of participants that will be collecting certain data. So I don't know if I understood well. Are these subset will be only for the use of CDEs, or you'll be doing the instruments in everyone? I didn't understand well that
Yeah,
part.
I know it's complicated because I'm just thinking that sometimes the issue that we have when collecting, for example, neurodevelopmental outcomes in a pediatric population is that not everybody has access to at every site in a large institution or large multi-site trial to the personnel who might be required to collect some of those common data elements, but they're still required or they're still desirable. And so I was just thinking, is that something that within the common data elements, purview, is this something that would be acceptable, or do they really want you to kind of pick your core, your general, your supplemental, and your exploratory, and include all of that for everybody in a particular trial?
I would say in the ideal world, yes, everyone should collect the same thing. But at the end, it's not about the CDs, it's more about, your rigor, the rigor of the study, the questions from the review panel, is this acceptable of you doing the power of the study? There are many questions to consider other than the CDEs. I think that will be a secondary thing on how you collect the data. First, focusing, is this, like good research, or is it rigorous the way we're going to do it?
It almost seems like you could use some of these studies to validate some of the exploratory CDEs too, or it's an interesting idea. Fantastic. Christy, any other questions?
No, I think it's, I was really thinking about your information that these can be expanded, because I think there's probably a lot of areas that we can all think of that would be helpful for in pediatrics specifically, where we could use some additional common data elements, and it'll just be how quickly can we get those elements rolled out.
Yeah, I understand there's a huge need in different areas.
So Carolina, that was fantastic. Thank you so much for joining us today. This was so every time I hear you talk, I learn something new. And so I learned a whole bunch of new stuff this time. So just as a reminder, all of our attendees, the session was recorded. It's going to be transcribed and then archived onto the NINDS website in the coming weeks. Details about where to find the archive version will be posted on social media and professional society listservs and newsletters. So I wanted to thank Carolina. I wanted to thank Christy. I wanted to thank Alba and Lena for all of their help, and Kevin for his help as well. We'll give everyone 5 minutes back in the hour so that if you're on the East Coast, you can start wrapping things up for the day. And if you're on the West Coast, you get time to go to clinic or lab, whatever else you have to do at the top of the hour. So thank you all very much. It was fantastic. And keep your eyes out for upcoming. We've got some really interesting webinars planned for the next calendar year. Have a great set of holidays, everyone. Stay safe, get vaccinated, and we'll see you in 2023.
Bye-bye. Thank you.